Hey everyone, my name is Lydianne Havilan, and today I will be talking about dengue fever, the trouble in tropical paradise. Dengue fever is also known as the dengue virus, aka dandy fever and breakbone fever, for its awful and aching symptoms. So this dengue virus is a mosquito-borne virus, so it is carried by tropical mosquitoes called the Aedes aegypti mosquito, and these suckers are found in tropical and subtropical regions. And actually, before infecting people, mosquitoes themselves can actually become infected through biting other people that have the viremic dengue. So the tropical mosquitoes Aedes aegypti are found near standing water as well as tires, and they love to feed on humans before the romantic sunset hour. A fun fact about mosquitoes, the mosquitoes that bite you are only female because they need blood for their eggs, and males just feed on nectar. So a little microbiology about the dengue fever. The dengue fever is an ssRNA virus. Its vector is an Aedes aegypti mosquito. It's part of the Floridae family. Also included in this family are the West Nile, Zika virus, as well as yellow fever. And dengue virus actually has 4 types of serotypes. And lifelong immunity is provided for each specific serotype if you are infected with dengue virus. Dengue virus is part of the Flavivivirus genus, and it was actually first isolated in Japan. And once again, the dengue virus is mosquito-borne, so its mode of transmission is mosquito-borne vectors. So the dengue virus is an RNA virus, meaning that it can only replicate inside a host cell's organism. It's roughly spherical in its structure, as depicted here on the right-hand side, and it also contains a shell of proteins. So the dengue virus shape, it's like a star. It's almost like the bell of the ball. It's a ball shaped. It also has some star-like proteins. It's spherical once again, and it also has a viral envelope and contains several proteins on its outer membrane. Which controls viral entry, and it's also pretty small. It's 50 nanometers. So the dengue virus is pretty much a trickster. So it's infected through using a mosquito-borne vector, and then this is how it infects you. So the dengue virus tricks your immune system. It essentially hijacks your body. So dengue virus transmission, it's actually spread through a mosquito's saliva and then it enters your blood. So imagine you're out on the beach in a tropical island in the middle of nowhere, you're sipping on some Mai Tais, maybe some pina coladas, and then all of a sudden a mosquito bites you. So viral attachment occurs actually when the virus attaches to your skin cell. So once that skin cell forms a pouch called an endosome that actually surrounds the viral particle, and once it's encapsulated, the virus looks like a disguised normal endosome and infiltrates the host cell and could potentially go into your bloodstream. So this is how it binds to your white blood cells. So the dengue virus, it binds to your white blood cells. So once it infiltrates the system via endocytosis, the virus breaks down to release its viral genomes into the cytoplasm of the host cell. So here we have the dengue virus and the antibody receptor. And notice how there's a pH change in the cell, which then allows for more dengue viruses to replicate. So once again, we see that attachment onto the white blood cell, which can then replicate into your other host cells and infect the host. So this is essentially how the dengue virus is able to hijack your own host's machinery so that it can replicate itself within your body. So the dengue virus is a butter, meaning that it takes advantage of the host cell's mechanism. So rather than bursting like, let's say, malaria and opening its contents into your bloodstream, what the dengue virus is going to do is that it's going to take advantage of your energy and your host cell's machinery so that it can then replicate, as depicted here on the right-hand side. So once again, we see that infiltration. So the pathology of the dengue virus. So once it enters into your host cell, then it can kind of see itself within the lymphatic system, and if it gets worse, it can even see itself in your blood circulatory system. So when it's in your lymphatic system, it goes into your lymph nodes and also creates swollen glands. And then also the reason why, one of the reasons why the dengue fever is also called breakbone fever is because a lot of patients suffer some body contortions due to the severe bone and muscle pain, which is a sign of dengue, which we'll talk about in a little bit. So the dengue virus difference. So kind of differentiating it from other mosquito-borne viruses, the dengue fever evokes this type of immune response. So it signals cytokines and interferons to cause headaches, fever, and muscle pains, and then it also enters your blood system when it gets worse to cause hemorrhages, which means blood leakages outside of the membranes of your blood vessels, which being so, as it leaks out, it causes an insufficient amount of blood to your vital organs and also can cause a lot of damaging presenting symptoms afterwards. So this is a typical blood vessel, and what happens when it leaks is that it just goes out where it's not supposed to be, and then that can also lead to organ failure. So these are some of the mild forms of the symptoms of dengue fever. So if you have dengue fever, your symptoms will usually take several days to a week to manifest. And when you're on a tropical vacation, chilling outside, sipping some Mai Tais, you don't want to be spending a week bedridden because you have dengue fever. So kind of important to practice some mosquito repellents and whatnot. But back to symptoms. Some of the symptoms of the mild form of dengue fever are a heavy fever, so 104-degree fever. You get headaches, you get eye pain, you even get the muscle and bone pain, which is why it's called breakbone fever. You also get nausea and vomiting, and even some skin rashes as well. And that's due to the reduction of white blood cells. So recovery of the mild dengue fever usually takes about a week, thankfully. So in terms of the severe form of dengue fever, this requires immediate medical attention and hospitalization due to its very severe form. These are the types of symptoms and signs that you'll see. So for example, if you have the severe form of dengue fever, you'll find that you'll have a hemorrhagic fever, which means that you're essentially going to have internal bleeding by these leaky, damaged blood vessels, and organ failure can persist within your lungs, within your liver, and your guts. And that fever really does pop a lot of vessels in your brain, which is not very good. So that's why it requires immediate attention. And because of that, hospitalization occurs, and usually you'll be put on an IV to regain loss of fluids as well as have a potential blood transplant. Dengue shock syndrome is another form of severe dengue fever, which seldom causes death so long as it's treated. It has a 1% fatality, thankfully. Shock syndrome refers to the fact that you'll have circulatory shock when your leaky blood vessels happen because of dengue. So the warning signs of this are feeling tired and restlessness, a tenderness in your belly. You'll even have some blood in your vomit as well as blood in your stool. And this is the worst and severest form of dengue. So on to the world statistics. So worldwide, the dengue virus puts 3.9 billion people at risk, and 70% of these dengue virus cases are found predominantly in Asia. 4.2 million cases were reported in 2019. That is compared to the 505,000 cases that were reported just 19 years ago in 2000. So talking about the places in Asia where it's most prevalent, dengue fever is found predominantly in the Philippines, Malaysia, Thailand, and even Vietnam. So it's found in tropical and subtropical regions, and this means that it's frequent in Southeast islands, such as those that were listed just a minute ago, also in the Western Pacific. So some cases have been found in Hawaii and also in the Americas. Sporadically, we also see the dengue virus being in Africa, so regions such as Madagascar and even Ethiopia, and then some parts of Europe such as Croatia, but these are sporadic in comparison. And the dengue virus persists frequently in low and middle income countries such as these Southeast islands. So immunity to the dengue virus, is it lifelong or is it not? So as we mentioned in the beginning, there are 4 serotypes of the dengue virus, and each have their own genetic variation in their genetic makeup. Being such, you can have lifelong immunity for one particular serotype that you're infected with. However, if you do get infected with dengue virus of a different serotype, you don't have immunity to that. And actually, in a lot of cases, we see that having immunity to one serotype does not blanket statement help you with other types of dengue virus. Instead, it actually puts you at a higher risk for contracting even worse signs and symptoms of that particular new serotype. So treating the mild form of dengue virus just requires taking a lot of rest and drinking a lot of fluids, as well as taking acetaminophen, but not aspirin or ibuprofen. In terms of testing for the dengue virus to isolate the virus, you'll use either some serological methods or virological methods. So for example, the ELISA method is used serologically to detect the presence of IgM and IgG dengue antibodies. And then also virologically, the NS1 antigen testing is rapid diagnostic testing, so it can detect the virus really rapidly. Lastly, I'd like to conclude with the vaccine crisis that occurred in the Philippines in 2016 regarding the dengue virus vaccine. In short, it didn't work, it made things worse, and there were adverse effects of the vaccine. So in 2016, the Dengue vaccine was administered to roughly 1 million children in the Philippines, and once they were vaccinated, shortly after a year, many children were diagnosed with the severest form of dengue, and it is believed that actually 600 children died from contracting the dengue virus after receiving the vaccines. So these two photos on the right-hand side were taken in 2018 as protests were erupting throughout the Philippines. This disaster was due to a lack of effective communication as well as a persistent mass immunization by the Philippine government. So the dengue vaccines were actually recommended by the World Health Organization only to be administered to children who had dengue infection in the past. But in 2016, the WHO recommendation was too late, and the Philippine government had already vaccinated 1 million children. So the controversy surrounding this vaccine actually lies within the dengue virus's biological properties. So for dengue, the antibodies aren't always protective, which means that in 2016, this made the infection of the dengue virus worse in children who received the vaccine but did not have prior contraction of the. Unfortunately, this occurred because of good intentions but faulty execution. But luckily now, we actually have a 2019 new dengue vaccine, which was created with promising results, specifically 97.7% efficacy within the second serotype of the dengue virus, and it is approved by the FDA. Unfortunately, however, the wrongs of the past are still seared into the minds of the Philippine community, specifically those that are parents who lost their children. So as the dengue virus commonly infects low-income populations in tropical regions as well as tropical tourists, these are some of the surveyed reports that parents in the Philippines have regarding vaccines in general. So in 2015, there was an 82% vaccine confidence within parents in the Philippines. But after the dengue virus mishap and controversy, in 2018, that confidence decreased down to 21%. In 2015, 93% of Filipino parents said, yes, vaccines are important. However, now in 2018, when they were surveyed once again, only 32% said that yes, vaccines are important. So after these dengue vaccine deaths, Filipino parents became even more skeptical of vaccines. So in conclusion, what do we do? How do we prevent it? If you're going out to tropical regions in the Caribbean, in the Southeast Asia islands, how do you protect yourself from receiving or not receiving dengue virus? Well, first off, mosquito repellent, bugger off and be gone. Kill the mosquitoes whenever you see mosquitoes, just kill them, smash them, squash them. You can also put screens on your windows as well as your doors, which acts as a physical barrier, and get rid of standing water or unused tires, which is a hospitable environment for these mosquitoes. And if you're asking why even bother with this, well, you never know which mosquito is carrying what virus. Mosquitoes carry yellow fever, Zika virus, and even dengue virus, which is one of the most common forms of viral mosquito infections. So, all right, now here are my resources. And last but not least, thank you all for watching the presentation, and I look forward to all of your questions.